A 65-year-old man presents to the emergency department with a 2-day history of a painful rash to the right torso. He has no significant past medical history. He is finding the pain unbearable. How should this patient be managed? Options are A. Oral flucloxacillin, B. Oral acyclovir, C. No treatment required, D. Topical permethrin, E. Topical hydrocortisone. The answer is B. Oral acyclovir. This is shingles. Consider the need for oral antiviral treatment. Prescribe an oral antiviral treatment within 72 hours of rash onset for people with any of the following criteria. Immunocompromise. If the level of immunocompromise is not severe, the rash is localized, the person is not systemically unwell, and they can be closely followed up. Non-truncal involvement, such as shingles affecting the neck, limbs, or perineum. Moderate or severe pain. Moderate or severe rash. Consider prescribing oral antiviral treatment within 72 hours of rash onset for all people aged over 50 years to reduce the incidence of postherpetic neuralgia, which is most common in this age group. If it is not possible to initiate treatment within 72 hours, consider starting antiviral treatment up to 1 week after rash onset, especially if the person is at higher risk of severe shingles or complications, for example continued vesicle formation, older age, immunocompromised, or in severe pain. A 8-year-old unvaccinated girl, originally from Hungary, is brought to the emergency department by her parents who are concerned about a non-itchy rash. She has been off school with a cough, conjunctivitis and a high temperature for the last couple of days, and the rash started this morning, appearing first behind her ears and traveling down her trunk, shown below. On examination, you note some white spots on her buccal mucosa near her back teeth. Which of the following is the most likely infectious agent? Options are A. Rubella virus, B. Mumps virus, C. Measles virus, D. Varicella zoster virus, Epstein-Barr virus. The answer is C. Measles virus. The patient most likely has measles, given the history of a prodromal phase preceding the development of a maculopular rash associated with Koplik spots. A 21-year-old man presents to the emergency department with a 2-day history of an itchy, crusting rash over his face. He has no past medical history and is otherwise well. On examination, you note yellow crusted lesions around the mouth and nose. What is the most likely causative agent? Options are A. Staphylococcus aureus, B. Staphylococcus epidermidis, C. Staphylococcus hemolyticus, D. Streptococcus agalactiae, E. Viridans streptococci. The answer is A. Staphylococcus aureus. Transmission of impetigo occurs directly through close contact with an infected person or indirectly via contaminated objects such as toys, clothing, or towels. Bacteria enter the skin through breaks caused by minor trauma, such as insect bites or scratches, or underlying skin conditions, such as eczema or scabies. The incubation period is 4 to 10 days. Non-bullous impetigo is caused by Staphylococcus aureus, Streptococcus pyogenes, or a combination of both. A 6-year-old girl is brought to the emergency department with a 1-day history of a widespread, itchy red rash. You are able to diagnose chickenpox. The child's mother is 15 weeks pregnant. What specific complication are pregnant women particularly at risk of? Options are A. Ares syndrome, B. Pneumonia, C. Myocarditis, D. Encephalitis, E. Hemorrhagic varicella. Answer is B. Pneumonia. Complications in pregnancy. Varicella in pregnancy can result in severe chickenpox. The mother is at increased risk of varicella pneumonia and other complications compared with the general adult population. Infection with varicella zoster during the first 28 weeks of pregnancy can lead to intrauterine infection and fetal varicella syndrome, which is characterized by one or more of skin scarring in a dermatomal distribution, eye defects, for example microphthalmia, chorioretinitis, and cataracts, hypoplasia of the limbs, neurological abnormalities, microcephaly, cortical atrophy, learning difficulties, dysfunction of bowel and bladder sphincters. A 4-year-old boy is brought to the emergency department with a one-day history of rash following a sore throat. The rash initially started on the chest before spreading to the limbs. On examination, you note an inflamed, red tongue. What is the causative organism in this child's presentation? Options are A. Staphylococcus aureus, B. Streptococcus pyogenes, C. Epstein-Barr virus, D. Parvovirus B19, E. Herpes virus type. The answer is B. Streptococcus pyogenes. Scarlet fever is a notifiable infectious disease caused by the bacterium Streptococcus pyogenes, also known as Group A Streptococcus, gas. When gas cause infection, the primary site is usually the throat resulting in pharyngitis. The rash and fever associated with scarlet fever are due to exotoxin or superantigen release by the bacteria. Scarlet fever can occur at any age but is most common in children between 2 to 8 years of age, median age 4 years. A 55-year-old man presents to the emergency department with a painful red rash on his face. He describes the rash appearing over the previous 2 days. What is the diagnosis? Options are A. Periorbital cellulitis, B. Ulcerative keratitis, C. Rosacea, D. Shingles, E. Cutaneous lupus erythematosus. The answer is D. Shingles. Herpes zoster ophthalmicus occurs when the virus infects the ophthalmic division of the trigeminal nerve, and complications include keratitis, corneal ulceration, conjunctivitis, optic neuritis, retinitis, glaucoma, and blindness if untreated. Seek immediate specialist advice. A 56-year-old man presents to the emergency department with a 2-day history of a painful rash on his torso. He has no significant past medical history. On examination, you note a vesicular rash on the right side of his torso. Following the T6 dermatome. The rash does not cross the midline. What is the causative agent of this rash? Options are A. Epstein-Barr virus, B. Varicella zoster virus, C. Cytomegalovirus, D. Herpes simplex type 1, E. Herpes simplex type 2. The answer is B. Varicella zoster virus. Shingles, herpes zoster, is a viral infection of an individual nerve and the skin surface that is served by the nerve, dermatome. It is caused by the reactivation of the varicella zoster virus, the same virus that causes chickenpox. Following a chickenpox infection, which typically occurs during childhood, the varicella zoster virus lies dormant in the dorsal root ganglia and reactivates when the immune system is weakened. Unlike chickenpox, which follows the initial infection and causes a generalized rash, shingles occurs years, sometimes decades, after the primary infection, and symptoms are usually localized to a specific dermatome. People with active lesions of shingles, particularly if they are immunocompromised, can transmit varicella zoster virus to susceptible people to cause chickenpox. However, there is no evidence that shingles can be acquired from a person who has chickenpox.